to have. And so today what we're going to do is a round of introductions. Next, I'll turn the mic over to Senator Marr.
Thank you so much, Representative Exum. I am absolutely delighted to be here with the tri-chairs and also all of the commissioners and providers and everyone who has given up their time in the summer to work on this incredibly important project. I can't think of anything I would rather be doing right now. As a social worker, I was speaking with someone after our initial press conference, and as a social worker, one of the things that we do is look at the environment. We look at the biopsychosocial, and we look at the environment and structure the environment to best serve communities. And so I hope to bring that work and work alongside all of you to create a better process for our children in Connecticut. And when we create a better environment for our children in Connecticut, we are creating a better environment for families across Connecticut. So thank you so much. Thank you all for the dedication that you bring to this work.
Thanks, everyone. My name is Claudio Gualtieri. I'm a senior policy advisor at OPM and am pleased to be Secretary Beckham's designee and a tri-chair of this committee as well. Really grateful for all of the effort that has brought us to this point today. We were just reflecting at a press conference earlier that passing a bill is really the promise that we make. In this case, the promise we make to our children. And I see this committee as being a critical component of ensuring that that promise is fulfilled and that we're delivering, and we're doing so in a thoughtful way. So I am so grateful for all of the individuals who have chosen to serve in their capacity here, the commissioners, the legislative representatives, people on the ground who are delivering services and understanding where the gaps may exist and vulnerabilities in our system, and excited to get to work. I like the TCB, let's get it done. And with that, I want to just turn some focus to our next agenda item, which will be an introduction of our other committee members. Just so that we can do so methodically, I'm wondering if we can take an attendance roll, listing the names of the members and pausing after each one so that they can briefly introduce themselves. Erica, can I ask for your assistance?
Sorry,
sorry. No worries. Thank you. So I'll turn it over to you.
Thank you so much. Welcome, everybody. We will call your attendance. Now, mind you, some appointments are still in process, so bear with us. We are in the process of collecting all the letters. So if your name is called and or you plan to designate somebody, please make sure to contact us at the Tau Youth Justice Institute. Donna will call a roll call.
Okay. Claudio, Tri-Chair Claudio.
Here.
Tri-Chair Susie Marr, Senator Marr.
Here.
Tri-Chair Tammy Exum.
Here.
Oops, sorry. Senator Anwar.
I'm here. Do you want me to introduce myself too, or might as well? So thank you so much. I'm honored to be part of this committee. Actually, in 2022, I was serving as the acting chair of Public Health Committee and the chair of Children's Committee. And these two legislations, Senate Bill 2 and House Bill 5001, were the most important legislation for that session. And when we passed these, I still remember that day that the legislators got together and we were all crying because this was a labor of love for our children, for the children of our state. And nobody wants to see any child be in any pain whatsoever, and especially the invisible pain is even more painful. So honored to be part of this committee, currently serving as the chair of Public Health, co-chair of the Public Health Committee. Thank you.
Representative Kristen McCarthy-Vahey.
Good afternoon. I'm here and I'm thrilled to be here also as co-chair of Public Health, as a mom, a social worker, and founder of Fairfield Cares Community Coalition, which is our local prevention council. So seeing what this means for our children who are seeking wellness, and for our families and our parents who need support. So I'm thrilled and honored to be part of this. Thank you.
Senator Heather Somers.
My name is Jeannie Milstein. I am Senator Summers' designee. I am the Director of Human Services for the City of New London and the former State Child Advocate.
Representative Nicole Clarides Detrail. Senator Matthew Lesser. Representative Jillian Gilchrist.
Hello, everyone. I serve as the co-chair on the Human Services Committee. I too am a social worker and a mom, and so I'm very pleased to be a part of this group. Thank you.
Senator Lisa Seminara.
Good afternoon, everybody. I'm Lisa Seminara. I am the ranking member on Children's and very much looking forward to our ongoing work in addressing this very important issue with a devastating thing that's happening in all our communities with our kids. And we really need to get to work and try to make sure that services are available to them. So really proud and happy to be part of this. Thank you so much.
Representative Jay Case. Representative Liz Lenahan.
Hi there. Good afternoon. I'm Representative Liz Linehan. I am the co-chair of the Committee on Children and have been since I think 2018. And our committee has been really focused on children's mental health for a long time. So I am thrilled to be a part of this. I do just want to say very briefly that while my focus has always been child-centric, I think my work on this committee is going to be really important because I want to expand that. There has been some information that has come out about the fact that there has been a lack of quick payment to providers through Anthem across the country. That is something I really want to work on. And that is hopefully going to be my focus on this committee. So I'm thrilled to be a part of that, because if we don't have enough providers getting enough money, getting paid, they're not going to serve our kids. So thank you very much for the opportunity to be here.
Senator Lisa Seminara.
You already did me. Thank you.
Sorry. Okay. Representative Ann Delphinius. Okay. Senator Catherine Austin.
Good afternoon. I'm Kathy, and I am happy to be on this committee. You don't need the rest.
Okay. Okay. Senator Aaron Berthel. Eric Berthel. Representative Tanny Nuccio.
Hi, I'm Representative Nuccio. I also worked on 5001 when it first came out, and I'm the ranking member of appropriations.
Okay, Dr. Javid Sakura.
Good afternoon, everyone. My name is Javid Sakara. I'm a physician, an educator, and a social scientist. I'm a practicing child and adolescent psychiatrist that is new to the state of Connecticut, relatively new. It's almost been 2 years, but I'm going to keep riding that for as long as I can. And I'm currently the chair and chief of psychiatry at the Institute of Living at Hartford Hospital. Thanks.
Great. Tammy Freeberg.
Good afternoon. I'm Tammy Freeberg. I'm the Vice President for Strategy and Planning at the Village for Families and Children, a regional multi-service organization based in Hartford. I'm honored by my TCB appointment, and thank Speaker Ritter for his support. I also wanted to just point out that I am now, it can officially be Tammy Cubed. I just
Jan Ponson.
Hello, everyone. I'm Jan Ponson, and I am a child psychiatrist, vice chair for clinical affairs at New Haven Children's Hospital. And I'm also medical director of our clinical services, along with having been medical director for our Yale New Haven Health System Children's Hospital inpatient unit and pediatric emergency department. So I am happy to be here and to serve in any way I can. Thank you.
Howard Savronsky.
Yes, good afternoon. I'm Howard Savronsky. I'm the Chief Behavioral Health Officer at Connecticut Children's. This is Connecticut's only nonprofit independent children's hospital. And I'm also a proud social worker and proud to lend my voice as part of a growing team of social workers here on this committee. Thank you.
Michael Patota.
Good afternoon, Michael Patota. I'm the president and CEO of the Child and Family Guidance Center. We provide outpatient mental health, substance abuse treatment, and care management to almost 3,500 kids a year in Greater Bridgeport and Greater Norwalk. Thank you.
Edith Boyle.
Hi, I'm Edith Boyle, President and CEO of LifeBridge Community Services in Bridgeport. Like Michael, we do outpatient behavioral health services to children and families and adults. I'm also a licensed clinical social worker, so I bring that perspective as well as a direct service provider.
Dr. Thomas Cosienda.
Good afternoon, everyone. I'm Dr. Tom Cosienda. I'm a psychologist and the Director of Behavioral Health Services for the Connecticut Department of Correction. Thank you for having me. I look forward to participating.
Commissioner Jordan Sheff. Lorna Thomas Buckarson.
Thank you. Good afternoon. Lorna Thomas Farkas, and honored to be here as a designee for Commissioner Beth Bai from the Office of Early Childhood. Within the Office of Early Childhood, I lead our behavioral health initiatives. But prior to that, my experience has been on the front line as it relates to behavioral health. Having my doctorate in clinical psychology, I certainly have seen the impact when interventions are not provided early on, how it can play out long term. So honored to be part of this committee and look forward to the work ahead.
Dr. Charlene Russell Tucker.
Hello, and thank you very much. Charlene Russell Tucker, Commissioner of Education. Very pleased to be a part of this group and say thank you on behalf of our 513 students in our K-12. I always have to put that out there so we know what we're talking about, the scope, but really thrilled to be a part of this effort in representing our students and our school staff. Thank you.
Cynthia Son Moyana. Gerard O'Sullivan.
Good afternoon, Gerard O'Sullivan. I'm the Director of Consumer Affairs for the State of Connecticut Insurance Department. Happy to be here, and we can assist consumers with any problems that they have with commercial insurance.
Dr. Kimberly Karanda.
Good afternoon, Dr. Kimberly Karanda. I am the designee for Commissioner Navarrete from the Department of Mental Health and Addiction Services. I am a licensed clinical social worker, have a doctorate in social work, and as the division director of the statewide services division, I'm responsible for the oversight of a number of initiatives that are 2-gen, family-oriented, and focused on children. Thank you for the invite.
Dr. Manisha Yutani.
Thank you, Manisha Jutani, Department of Public Health. I am attending the meeting today, but will also be designating Dr. and Deputy Commissioner Jody Terranova, who's in the audience, and a pediatrician by training as well. So hopefully that combination will represent us well at DPH in this meeting. Thank you for having us.
Yvonne Pelota.
Good afternoon, everyone. My name is Yvonne Palato. I'm a Social Services Medical Administration Manager for the Department of Social Services. And I'm also a licensed clinical social worker, and I am the designee for Commissioner Andrew Barton Reeves. I'm honored and excited to be part of this task force.
Dr. Deirdre Gifford.
Good afternoon, everyone. Deidre Gifford from the Office of Health Strategy. Delighted to be part of this conversation. OHS has been part of a multi-agency group that's been working on issues of children's behavioral health under Commissioner Durantis' leadership and in collaboration with the commissioners that you've heard from already this morning, this afternoon. And OHS is also undertaking a study looking at payment for children and adult behavioral health services that will be completed by the end of this year and hopefully will be informative to the work of this group. Look forward to participating. Thank you.
Sarah Egan.
Good afternoon, everyone. My name is Sarah Egan. I run the state's Office of the Child Advocate, which is an independent state agency charged with reviewing and reporting out regarding the provision of state-funded services to vulnerable children. As you can imagine, we hear frequently from folks around the state, including families about not being able to access the care they need when they need it, which is really the theme that I think we're trying to address here, because I think the report card for the children's behavioral health system is, can people access the care they need when they need it? And that's really the only barometer that matters. And I'm excited about approaching that in a really systemic fashion. And I know it's a marathon, not a sprint. So we appreciate everybody's commitment and the inclusion of our office. Thanks very much.
Ted Doolittle.
Good afternoon, everybody. I'm not Ted Doolittle. My name is Sean King. I'm the General Counsel for the Office of the Healthcare Advocate. I'm Ted Doolittle's designee on this committee. We do appreciate the opportunity to contribute to the important work of this committee, and to piggyback a little bit on what the Child Advocate just said. Our office deals with a lot of access issues as well, primarily around payment issues, insurance coverage issues, things like that. So we look forward to providing that perspective and contribution as well.
Kathy Foley Guide.
Good afternoon. I'm Kathy Foley-Geib. I'm the designee from the Judicial Branch Court Support Services Division. I'm the Deputy Director responsible for juvenile residential services, as well as the Juvenile Court Clinic. And I appreciate being here to represent the interests of behavioral health needs of children who are involved in the juvenile justice system. Thank you.
Stephen Hernandez.
Good afternoon, everyone. Stephen Hernandez, run the Commission on Women, pardon me, Women, Children, Seniors, Equity and Opportunity, nonpartisan agency of the legislature, and just really want to thank the vision of this legislature and this group for acknowledging that children do not exist in a vacuum in the state of Connecticut. Their family context really does impact their behavioral health and their outcomes, and it's important that families be included in these conversations. So thank you so much.
Sherry Shapiro.
Hi, Sherry Shapiro, Executive Director of Kids in Crisis, a regional emergency shelter program serving Southwestern Connecticut with school-based programs in 17 schools as well.
Mike Myers.
Hello, my name is Mike Meyer. I'm the Director of Family and Community Engagement for the Stanford Public Schools. We serve about 16,000 students, 2,000 staff. Our office does hear about the impact of COVID, the impact that mental health has on our children, our staff, and families. I'm very honored to be appointed to this committee, and I look forward to this important work.
Ashley Hampton.
Good afternoon. My name is Ashley Hampton. I am the Clinical Director at Domus Kids out of Stanford. I'm also a licensed clinical social worker, and I'm very much looking forward to the important work that we're looking to complete amongst this committee. Specifically, I'm very excited to be able to increase mental health accessibility, specifically for young people who are members of underserved and underrepresented populations.
Ann Smith.
Thank you for inviting me. Ann Smith, I'm the Executive Director of African Caribbean American Parents of Children with Disabilities, which is why you will more commonly know us as AFCAMP Advocacy for Children. I am honored to have been asked to join this entity, and I'm also bringing the perspective as a tri-chair of our Connecticut Children's Behavioral Health Plan Advisory Board, which is also legislatively enacted, and am representing my fellow tri-chairs who are out of state right now, but look forward to this opportunity to build on the work of the advisory board, which is charged to help us to implement in Connecticut a system that serves all of Connecticut's children. It is built off of the Children's Behavioral Health Plan that was put together with the input of families and communities, and I'm hoping that we will have that opportunity to ensure that the perspectives of families and communities are represented in the work of this group, this very important work, and I'm honored to have a part in it. Thank you.
Representative Kai Benton.
Good afternoon. I'm Representative Kai Belton. I represent Middletown, 100th District, very new legislator. I'm also a EMPS clinician for Middlesex Health, and I am thrilled to be here.
Dr. Derek Gordon.
Perfect placement. Good afternoon, everyone. My name is Dr. Derek Gordon. I'm an associate professor in the Department of Psychiatry and at the Consultation Center in New Haven. I'm a licensed clinical psychologist, and I function as a clinical community psychologist in the greater New Haven area.
Representative Tony Walker.
Good afternoon, everybody. I'm thrilled to be here, and I'm really thrilled at hearing all of the social workers and the clinicians here. It makes me feel so at home and comfortable, and I look forward to hearing from everybody. And my designee is Dr. Derek Gordon, who's extremely modest, so I'll just leave it alone at that. So thank you very much. Thank you. It's an honor.
Thank you. Those were the names on our list, but I recognize that some individuals might have walked in. If we do not have your name, or if you've been identified as somebody that is appointed and or designated, would you mind letting us know now? Oh.
Oh, well.
Commissioner Durantes.
Oh my God. Well, if that doesn't tell us something, I am Commissioner Vanessa Durantes, the Commissioner of the Connecticut Department of Children and Families, the statutory authority for children's behavioral health in Connecticut. And I'm extremely excited to see everybody here and their commitment to children's behavioral health, particularly for all children across Connecticut, no matter what their zip code is, suburban, urban, rural. I want to make sure that I highlight, particularly because of the state ICWA that passed with the diligence of Senator Austin, making sure that we don't lose sight of our Indigenous children that are also in Connecticut and of need of our attention. So thank you to everyone and all of your commitment to serve, but also to make sure that we can effectuate good outcomes for kids and families. Thanks.
Thank you. There are two more individuals.
Christopher Trombley.
Good afternoon. I'm Christopher Trombley. I'm an associate professor of educational leadership at Southern Connecticut State University. I am also the co-chair of the task force to study the comprehensive needs of children in the state. We're completing our third year of work right now. And germane to this committee, I was a longtime school principal, and before that, a longtime school counselor.
And I cannot see your name all the way back here, so I'll ask you to introduce yourself.
Good afternoon. I'm Carrie Borden. I'm the Executive Director for Caroline Behavioral Health, formerly Beacon Health Options, representing the Administrative Service Organization for the Connecticut Behavioral Health Partnership. And I'm also a licensed clinical social worker, and I'm thrilled to be here.
Any others? Or virtually on Zoom? Okay, thank you. Right chairs?
Thank you so much, Erica and Donna, for that. I also want to mention I do think Alice Forrester should be up here as well.
Come on down.
I think that was an oversight. So please
come on down.
Please come on down and introduce yourself. Sorry about that oversight.
As you can see, we're getting all of our memberships squared away
yes.
in real time.
Real time. Thank you so much.
Hi there. Thank you so much. I'm Alice Forrester. I'm the CEO of Clifford Beers Community Health Partners, which is a network of affiliates of nonprofits that serve children and young adults in New Haven and the Fairfield County. Clifford Beers Community Care Center, the Fairfield Community Care Center, and Youth Continuum, which focuses on homeless youth 16 to 24. Thank you.
Thank you so much. And as you can see, this is quite a committee. I mean, this is exactly what I would want to hear in the mix that I would want to have in order to move forward in our shared mission of really understanding what the landscape is and really providing the best mental health or behavioral health services for our children throughout the state in all different demographics. And so I am so thankful for your time and your presence. Next, I would like you're probably wondering, some of you, who are these two ladies sitting in front of you? And so this would be the perfect time to introduce our support staff who we could not do this work without for sure. And Erica Nowaskowski, she is our Chief Operating Officer from the Tau Youth Justice Institute. And I will turn it over to you and then you'll make the other introductions. Thank you so much.
Thank you so much. Very excited to be here and very excited to get to work. I love the TCB. For some of you that know me, I am very much somebody who likes to deliver. And so our goal is to help you all deliver on your goals. And so let me just introduce myself a little bit. My name is Erica Nowaskowski. I work for the Tau Youth Justice Institute. I have been with them close to 8 years. The Institute was coming in on close to 10 years in being in place. It is an institute at the University of New Haven. You may know us from doing this exact same work for the Juvenile Justice Policy Oversight Committee, and we are very proud to do the work there and support the work that Representative Walker has been spearheading, plus many of you who sit on this committee also sit there. It is a very collaborative effort. It is our goal to be responsive to the children in the juvenile justice system, but it is also a fact that many of those children in the juvenile justice system also are multi-system involved, and many of them have behavioral health needs. And as a social worker, graduate from UConn School of Social Work, policy focus, I do love policy work. I am one of those people that can read a manual and just enjoy reading a manual, but I like to take it apart and build it back together again. And I very much believe in the policy work. I believe in collaborative leadership. And I really believe that we can be responsive to our children's needs by working together. And so when this opportunity came up, it was just something that helped to round all the work that we already do. We, though you may know us from the juvenile justice arena, we are about advocating for all children in whatever part of the system they are involved in. Our goal is to see healthy, productive young children grow up to be healthy, productive adults. And so if we can do that together in partnership, we are being successful and responding to them. And so I look forward to working with all of you in this next adventure. And now I would like to give the floor to my colleague here, Donna, my partner in crime.
Hello, everyone. Donna Fromer. I'm the Director of Development and Communications for the Tau Youth Justice Institute. As Erica has been, I've been with the Institute for about 8 years. And we are doing amazing work, and we're passionate. We make it happen. We're small but mighty, and we put our minds to it, and we get things done. And so we are hoping to be able to do that, planning on doing that for you all as well.
Thank you. And so the work that we will be doing, we'll dive into that a little bit further, but I do want to say that the work that we will be doing is going to be helping to set up a roadmap for you all. But we're not going to do this alone. As the tri-chairs mentioned earlier at the press conference, there are other content experts that will be participating in this work alongside with you all. And we do have the University of Connecticut, Michelle and Deborah, who are on Zoom at this moment, and I will ask Michelle to introduce herself first and provide a little bit of background, and then Deborah.
Sure. Thank you all for having us. I guess at this point, I should say I'm a proud social worker and mom, so I can join the club of all of you that are together. So thank you. We're really excited to be part of this work and to partner with Tau and support the agenda that you've laid out for yourself and the state of Connecticut. I'm Michelle Zabel. I'm Executive Director of Innovations Institute and faculty at UConn School of Social Work. Innovations has been around we're coming up on our 18th year, and our role in the country really is to provide implementation support and translational research, policy, and finance efforts for across all systems that are responsible for children, youth, and their families. Anytime a child is having to access the public system, we know that their outcomes are at risk. And so our mission and vision for the last 18 years is to support funders, purchasers, meaning state and county implementation providers in improving those outcomes. So we work in about 42 states in the country on any given year and do that in a variety of ways through our research and evaluation group, our workforce development, systems design and implementation group. And I have my colleague here, Deborah Harberger, who leads our policy and finance group. So we're here to support you. We're here to try and provide the best explanations as to how Connecticut can think about moving forward, whether it's through finance or workforce initiatives or policy agendas, and answer any questions. So we're kind of the back end research team that supports your work. And I'll let Deborah introduce herself real quickly and then hand it back over. Thank you.
Hi, Deborah Harberger. As Michelle said, I'm with Innovations Institute faculty here. I do policy finance work and have gotten to know some of you in Connecticut doing work with the colleagues at OEC. I'm looking forward to getting involved with this work and supporting you however we can.
Thank you, Deborah and Michelle. So now I just want to dive into a little bit about the work that we're going to do. We do have one more partner to acknowledge, and I'll do so soon. But with the Tau Youth Justice Institute, the work that you will be receiving from us is to help facilitate as well as support, do an administrative support to the work that you're doing. So for example, your monthly agendas, your meeting minutes, your meeting summaries for any work groups that you all may want to be participating on in the future. We will be talking about that. And, you know, agenda attendance and so forth. So a lot of the communications will be coming from us. So that's more of the administrative task. But the other pieces of work that we bring to the table and experience is, so for example, operationalizing a lot of your work. So you have a legislation that says you have certain tasks that you need to do, certain reports you need to submit, certain benchmarks you need to measure, certain outcomes you need to report on. And so our goal is to identify, go through that legislation and break it apart. Like the puzzle I said, break it apart, and then identify and prioritize what areas you want to work on first for the first 6 months, then the next 6 months after that, and then 2 years from there. And in order to be able to do that, to identify the work that we're going to do, we're going to need to build a strategic plan. And that strategic plan is and will be your roadmap. And one of the best lessons I learned from Lael Chester, Rep Walker, you may remember her. She did an amazing job in helping us to create a strategic plan for the JJPOC, is that a strategic plan is a living document. And though we do set the roadmap for 3 months, or I'm sorry, for 3 years, we do know that detours happen. We do know that construction work happens. And so then that means that we may need to modify that strategic plan a little bit, but it will be done in agreement with all of us together. But that roadmap is what's going to set your priorities, what you're going to measure, and what you're going to report on. And we cannot create that strategic plan on our own. We need to do it together. So one of the first tasks that you all will be charged with is to help design and develop a strategic plan. And so that will be something that you'll be hearing from us soon after this meeting as to who would like to get involved in that development. Other areas of work that we will be doing to support UN is how to operationalize some of this work as well. We all have jobs other than this committee, but many of your jobs are involved in this work day to day. And so you are the content experts. You are the individuals that we look for your advice and input on how to get some of this work done. So we will operationalize it and create very few work groups. Very few work groups. They're going to be targeted. They're going to be time sensitive, and they're going to be clear to what the goal is. Okay. And then lastly, what I would say is that, again, we are not going to do it all, right? We're all doing this together, but we need other partners. So UConn is one of our partners. A third partner that you might have heard Rep. Exum mention earlier is Karen Snyder. She will be involved. She is from Massachusetts and has been, I had her bio. Sorry, let me just read her bio here. or I do not have her bio, I'm sorry. But Karen Snyder will be a content expert for this committee and comes with experience in the field of Massachusetts or in Connecticut, in Massachusetts, excuse me, as well as working here in Connecticut in the past. I will make sure to send off her bio to you all. And then I would say that there's also a question mark. There are definitely other partners in Connecticut that we should be tapping into and working with because they may have extensive experience in this field. And maybe they are responsible for reporting on some of the things that we need to report on. And we should not be duplicating efforts. If that work is already being done, let's partner with them. Let's ask them what's working, what's not working. Let's let them be the ones to somewhat educate us on how we can utilize them versus us trying to reinvent the wheel. So there'll be some other partners probably coming down the way that we can work with. Okay, and in the sense of in the sense of the team that you will see from Tau Youth Justice, you'll see myself. We are in the process of hiring 2 support staff, a senior project manager, as well as a project coordinator. As you can imagine, there's a lot of reports, a lot of administrative tasks. So I am hoping that those new hires will be here at the September meeting, and you'll get an opportunity to meet them. And for some of you who also know me, I also believe in a backup plan. I always put no offense to anybody, but I always believe in a backup plan. So I have also 2 faculty from the University of New Haven who are available for consultation. And Dr. Whitson, would you mind please introducing yourself? No, Dr. Whitson.
Okay. I'm Melissa Whitson. I'm professor of psychology at the University of New Haven. I'm the director of our community psychology master's program. I'm also a licensed clinical psychologist and a mom as well. So I'm very happy to be here and excited to support and back up or any other fashion. Thank you.
Thank you, Dr. Whitson. And we do have one other faculty, Dr. Carl Mingus. He is the associate professor and chair of the Department of Population Health and Leadership. He's the director of Master of Public Health Program, Department of Population Health and Leadership School, and School Health of Science. And he will also be somebody that we will be tapping into in his knowledge and expertise. With that being said, I believe that is, if anybody has any questions about us or anything else I can answer.
Thank you so much, Erica. The thing that we're moving on to our next steps, and the next steps are really looking at our meeting time. This is a large group, but as Erica indicated, we will be working in smaller groups once we've identified exactly what we're going to do, but we will be working on an ongoing basis. So when we look at the time commitment, we intend to meet once a month with the exception of August. And we will, right now, there's been a survey that was circulated. The survey results indicate the first Wednesday of the month from 1 to 2:30 has been the preferred time. I guess the only question I have is with everyone here today, has everyone had an opportunity to respond to that survey, whether or not we should?
What we can do is we can keep the survey open until Friday if everybody can complete the survey. It was sent when you received the invitation. There was a link in the invitation for the survey. If you can complete that, and then we will be able to submit a response as to the scheduled consensus date.
Exactly. Thank you. And if you need, if you did not receive that invitation, please let us know so that we can be sure that you receive that information so you can give your vote, and we can then finalize our regular meeting schedule as a body, as this particular body. So at this time, I just wanted to see if anyone has any questions of us or any comments that you would like to share. We did that good of a job. No, thank you. So I wanted to turn over and ask whether or not Cece or Claudio, if you have any additional comments you would like to make.
Thanks so much. It's just really very simple. Just this doesn't seem right now like we know exactly what the next steps are. So I just want to put that out there, but we will. And we will with all of your input. That's one of the reasons we're doing it this way, is because we want to hear from all of you. We don't want to presume that we know what the next steps are. So we'll all be getting together and working on that. I have great faith in Erica and her backup plan. And I'm so grateful again to be working with all of you.
Yeah, I'll just say very briefly, I think all of us approach this work from different levels of understanding. And so the tri-chairs in consultation with Tao have already begun to think through what 101 and educational materials that we could bring to light, just to make sure that we're all level set and we're getting the benefit of working with the same metrics, vocabulary, and the system that exists. So I appreciate that and look forward to more meetings ahead.
And absolutely, and you'll be hearing more about that, because I think understanding what the landscape is and understanding what has been referred to me as alphabet soup of what happens around behavioral health, so that we have a clear understanding. We do think it will be important to do some type of training so that we're at least all at the same place. And this was intended to be an introductory meeting. It's intended for us to be an organizational meeting, and we will be definitely all coming together, as many of us as possible, in September. But always know you can reach out to us if you have questions. Taylor Hyde is also our clerk, and I didn't introduce her, so thank you. I tell you, without all of this incredible support, really, it would be so difficult to do. But thank you so much for your time and your attendance. I want to be respectful of it. Thank you for all of your support. I am so excited by the work that we will do together as a group. So thank you. Have a good afternoon.
Huh? Yeah, it went well.
Very well.